to understand more what is MISC, yeah, all-rounded COVID-related information, and the do and don'ts about the COVID infections. At the end of this webinar, we are very sure you will get very useful, good tips about COVID infection prevention back home. Should you have any question, please, write it on your chat box or the Q&A chat box. Your question will be answered in a minute or at the end of the webinar. Okay, first of all, let me give you a brief introduction about our speaker, Dr. Tarik Jackmak. Dr. Tarik Jackmak has pursued the field of psychoneuroendocrine immunology, which is PNEI, over the past 15 years. He is currently the scientific advisor at Glutama Lab, a dermatological pharma company, and its sister concern Herbicide to develop a low-dose cytokines. He is associated with FLCC, with its Federal of Clinical Immunology Societies. He has 2 international patents in his name and is developing new and innovative products. He conducts regular training programs for health practitioners and doctors in the field of immunology, the roles of immunology in various diseases and their pathway, and also training on different cytokines and homeopathic remedies and treatment modalities for various diseases. His expertise and in-depth understanding of immunological pathways, along with his efforts in various chronic diseases, has enabled him to help many doctors with their patients across the globe to get better and well from chronic disease conditions. So he is one of the most qualified person in the world who tell you any COVID-related information and how we can deal with them successfully and effectively. Okay, first of all, before I ask this gentleman to talk, I would like to call upon several doctors who is also Dr. Tarik's student to share their own journey of the COVID experience. So the first person I would like to call upon is Dr. Ray. Dr. Ray, are you there? Hi, Dr. Ray. Are you there? Kindly unmute yourself and share your personal experience about COVID. Okay, we wait for a while. Maybe Dr. Ray is not logging in. Meanwhile, when we wait for Dr. Ray, I was just confirm other doctor is on air. Okay, Dr. Sharifa, are you there, Dr. Sharifa? Okay. Anyway, I call another doctor. Dr. Shah, are you there, Dr. Shah? Hi, Dr. Shah, are you there? Dr. Shah, are you there? Okay, Dr. Ray seems is on air now. Hi, Dr. Ray.
Hi, Amanda. Can you hear me?
Yes, we all can hear you.
Okay, good evening, everyone. I would like to share my experience of infected by COVID, and my mom, my sister, and myself, all of us in our family were infected. So we, 3 of us, we had the similar kind of symptoms: headache, fever, severe body ache, giddiness. So on the day 1 itself, we started taking antiviral combo, anti-IL-1, Ferrum Force, and Imucil. And for myself, day 3, I was still having high fever. So after consulting with Dr. Tariq, he advised me to take EBV. After taking that, the next day, my fever settled. And on the day 4, I had like a shooting pain over my right jaw, mandible area. And again, I discussed with Dr. Tariq, and he asked me to take Macrophage. After 3 doses of taking that, my pain has resolved. Even until now, I don't have the pain. So, so we feel a lot better, but we're still carrying on with our antiviral combo and the Immucil. And hopefully we'll recover completely soon. And I'd like to thank so much for, Dr. Tariq for his guidance and his advice. Thank you.
Okay, thank you, Dr. Ray, for such a informative sharings. Thank you very much. Okay, I hope you to get 100% fresh soon. Yeah. So secondly, I would like to call upon Dr. Shah to share your own experience with COVID. Hi, Dr. Shah, are you there?
Yeah, hi Amanda, can you hear me?
Yes, I can.
Hi everyone, I'm Dr. Shah, and I'm wanting to share my personal COVID experience with everyone today. I think as a parent, one of the biggest fears today is when you find out your child or your loved one is affected by COVID. You know, as parents, we rather it happen to us than our children. And as a medical doctor, you know, practicing, I've come across many kids that have been affected with COVID, and you know, we see them getting worse and progressing into MISC complications. It's a very sad thing to see, and you know, you don't wish it upon any child to go through this. Unfortunately, in early March, my whole family, that's 8 of us, we were affected by COVID. One by one, I saw my kids, my husband, my mom, my dad, all, you know, fall ill. I myself was affected by COVID. But what I feel as a blessing, you know, to me was being a student of Dr. Tariq and belonging to this amazing group of and supportive doctors. You know, many of them who came forward, who helped, advised, guided me as to what I should take, what I should avoid. Dr. Tariq himself, you know, personally called, and it was very, how would you say, it was a journey that I experienced personally. Obviously, I started family with antiviral medications, Amethine, Immucil, the host of immunologics, you know, low dose precision medicines. And I must say, the duration of symptoms were a lot shorter and not as severe as compared to many other patients or friends or relatives that had undergone COVID. We all recovered with God's grace and, you know, help from the whole community of doctors that were here to support me. Well, the kids are back to normal. I must say they are themselves excited and hyper as usual. My mom is doing a lot better, but you know, she's still a bit tired. But we do see progress, good progress day by day, and pray to get over this soon. We are still on some of the combos, antiviral combo. And yeah, I would love to sincerely thank Amanda, Dr. Tariq for such amazing support. Wouldn't have done it without you guys. Thank you so much.
Okay, thank you, Dr. Shah. What a wonderful sharing. Okay, I wish everybody here all wealthy and healthy. Okay, so now they come to the third person. Okay, I would like to call upon Dr. K. Dr. K, are you around? just hold on. There will be some technical issue now. Okay. Dr. Na, are you around? Dr. Na? Dr. Na? Are you with us, Dr. Na? Please unmute yourself to talk.
Yes, hello. Hi, everybody.
Yes.
Can you all listen to me? Can or not?
Can.
Okay. Thank you very much, Amanda. And then, so I'm Dr. Na. Okay, actually, I also had a bad experience. I mean, I also infected by COVID last month. It's not only me, and also my wife and my 4 children. But I'm quite lucky because I've been in this group and the case decision group, even though I'm not active in that group. I'm not a good student of Dr. Tariq as well, but I do read some of the notes that have been given by Dr. Tariq, and thank you very much, because I started with fever and also cough. After day 1 and day 2, I only realized that my swab test positive after day 3. Even though day 1, day 2 is negative, and then after that my wife positive, and then my children. I suffer for headache and also for fever, and then but one lucky thing, all my 4 children, they only suffer for mild fever. But one good thing, after I was infected with COVID, I straight away consult my good friend Dr. Aziz, and then also Amanda, and I also read notes by Dr. Tariq. And then I ordered the combo, antiviral combo for my family. And we really took it, I mean, seriously, as been advised by Dr. Tariq, for example, 20 drops for every 2 hours. And then I really make it after day 3. Day 1 and day 2, yes, it's really headache and fever. After that, day 3, most of the symptoms resolve. Only I suffer with a body ache until day 5. Luckily, my wife and my children survive, without any bad symptoms and complications. I think that's all for today. Thank you, Amanda. And also thank you, Dr. Tariq, for your such a wonderful advice and also classes. And thanks to my good friend, Dr. Aziz. And back to you, Amanda.
Okay, thank you, Dr. Na. Thank you for a precious sharing. And Dr. Na actually is very early stage when he called us, and he called Dr. Aziz, and he is good to know that to get the knowledge deeper when he get infected, but all well, you know, and he recovered very well. The whole family recover very well, and this is all the credit go to Dr. Tariq, because he is such a very good doctor and very good teacher to teach all these precious knowledge to us. Okay, so now without further delay, I'll call upon Dr. K. Dr. K is my dearly friend and wonderful doctor. Dr. K, can you
hear me?
Yeah.
Okay. Hi, everyone. So I've got 5 cases to present, 2 of which will be from the old Delta strain, and 3 from the Omicron. So my first case goes like this. It was a 1 year, 3-month-old baby with Delta infection sometime in June last year, who I started immediately on the low-dose precision antiviral drops, 10 drops 3 hourly. And when the child woke up, we will continue with those drops. So on day 4, however, the child developed a sore throat with minimal cough. We added 2 types of homeopathics to counter the symptoms. On day 6, it developed respiratory distress in the early morning. It was about 4 a.m. when the mother called me. There was chest indrawing, but the saturation was still good at 96% on air. So at that point, I asked her to give 2 drops of a certain homeopathic remedy, and within 10 minutes, the chest indrawing stopped. On day 10, the child developed POTS, which is postural orthostatic tachycardia syndrome, which many would term as MISC now. wherein the mother noticed that when the child was lying down, the heart rate was between 80 to 90 beats per minute, but when the child was up and standing, it would raise up to 120 to 140 beats per minute. She was again given just one dose of a homeopathic, and the heart rate returned back to normal within about half an hour or so at 110 minutes, and it remained that for the next few days, both lying and standing. The child recovered very well, and on day 12, when I reviewed the child, all effects of COVID were gone, and the child was happy and back to its normal self. So that was my first case.
Wonderful, Dr. K.
This was last year's case. Then subsequently, we had another case of a Delta variant patient sometime in August last year. This was a dear friend of mine. So she is actually an evangelist. So she has chronic adrenal fatigue with underlying low cortisol levels. So her BP on a normal day would be 90 to 100 systolic, 50 to 60 diastolic. This is her normal. So when she got COVID, she really was hit quite hard. On day 4, that's when she presented to me, she was extremely lethargic with a sore throat, headache, cough, mild shortness of breath, and oxygen saturation was 95% on air. She was very, very lethargic. She couldn't even get out of bed. She was given the low-dose precision antivirals along with several homeopathics to counter each symptom. Her saturation picked up within over 2 days to 97%. Then on day 7, she started complaining of a severe diarrhea and fainted several times in the toilet as well. We added some homeopathics to counter the diarrhea and gave her some ORS to bring up her pressure as well, you know. And despite doing all that, her BP was still crashing. So in the evening, I decided to use some vitamin B12 and some acute medicine homeopathics to push up the blood pressure. Within 30 minutes of treatment, her BP picked up and went up to about 90 by 50. That was very good because when I saw her, it was 40 by unrecordable. So that was very, very bad. Then on day 9, she started having rib pain with cough on lying down. So we added some homeopathics again, treated that out. And by day 12, her BP was 100 by 60. And oxygen 98% on air. Day 14, she was very well with oxygen back to 100%. Her chest X-ray was normal. We did a blood test which showed a slight elevation of D-dimer, but we corrected that with homeopathics as well to bring it back to normal. So that was the second case. That was my toughest case because it was such a challenge with her, you know, her low cortisols. Now, my third case is myself. I contracted COVID in early February this year. It was Omicron. And with a background history of rheumatoid arthritis, I was hit quite hard. It started with a very, very severe headache for 4 days. I realized it must have been vasculitis given that I have RA. It's a pro-inflammatory condition. So I took some homeopathics to dilute my blood along with the low-dose antivirals from Dr. Tariq. And within a day, the headache stopped. I started to develop a mild cough with wheeze on day 8, even though I was taking a Montelukast that generally helps with asthma and allergic bronchitis. Along with the cough, I had a severe burning pain in the abdomen, and the slightest spice in my food sent me having this really bad burning, churning pain in my tummy. My skin also was tingling most of the time with a burning sensation all over. And my oxygen saturation actually started to crash at that point, and I started to panic because it went down to 88%. I took a homeopathic to calm my nerves first, and then I also took the homeopathic for burning pain every 2 hours. And within a few hours, my oxygen started to climb up. By evening, it was about 94%, and the chest tightness and shortness of breath had eased up. By day 10, I had mild fungal infection of the oral cavity, which was treated off with nystatin and some homeos and some low-dose medicine as well. On day 14, my chest x-ray showed clear lungs and my blood test was almost normal with a very slight elevation in a D-dimer, which was treated off with the homeos that dilute blood and some fish oil. So that was my third case, which was myself. Now, case number 4. This is a case of a 66-year-old lady who had taken a certain antiparasitic medication, which is popularly used for COVID-19, along with high-dose vitamin C and zinc, apparently prescribed by a pharmacist, and was getting very lethargic at home. And her oxygen was desaturating, and she was desaturating. Her oxygen on day 3 was 94% on air, and she had hardly any energy to sit up in bed. She was also coughing quite badly. I asked her to stop all her medication and start on the low-dose precision medicine, along with some homeopathics for her lung and to prevent blood clots. But she also had a headache at that point. On day 5, her oxygen was at 97%, which climbed up from 94. And she was out of bed, tending to herself, feeling energized, and her cough was very mild. On day 7, she was back to normal and her oxygen picked up to 98%. Day 10, patient's RTK was negative, but her oxygen was still at 98%. So I decided to do an early chest x-ray given that the oxygen didn't correct, and we found a very small left pleural effusion, which is fluid in the lungs on the left edge of the left lung, probably due to the initial cytokine storm created by the medication she was taking. We continued treatment with low-dose medicine for lung repair, as well as the antivirals and antifibrosis. And it's day 28 yesterday, and we repeated the chest x-ray. The lungs have totally cleared up. Oxygen is back to normal. That's my 4th case. My 5th case is a very short one because it was a child. This was about a month ago. We had a 2-year-old child with Omicron as well. Presented on day 2 of illness with abdominal pain and vomiting. This child has had a pre-existent congenital heart disease, which is BSD, which is a ventricular septal defect. The child has not had the defect corrected just yet. The child was slightly cyanosed with oxygen at 92% on air, with no other signs of respiratory distress. So given that he was slightly dehydrated as well, we gave him some ORS, and then we added the low-dose precision medicine along with homeopathics to correct the diarrhea and vomiting and abdominal pain, and also for lung repair. So on day 3, which is the next day, the mother reported that cyanosis had completely resolved. Oxygen was at 98% on air, no more vomiting and abdominal pain. Child was eating and active. On day 4, child was back to his normal self. Oxygen improved to 98 to 99% on air. So I advised the patient to continue low-dose medication for another month. All right, those are my 5 cases. Thank you very much, Amanda, for letting me share this.
Hi, Dr. K. Hi. So I just wanted to thank you all for sharing your cases, and you'd be able to tell us how many cases now you've done, Dr. K, with the antivirals?
I think more than 300 cases easily since last year. Yeah.
And across what types of cases you've done? I mean, I know personally from you that we've worked on cases who were in the ICUs, we've worked on cases who were near death as well.
So I've treated babies as young as 2 months to the elderly as old as 90 years old. Also cases in the hospital, Cat 4 and Cat 5, which we managed to somehow send them medications while they were in hospital, and they've all come out well.
That's good to hear. You've had any cases which have not responded, or where you've had to use any other allopathic drugs, like the ones which are currently used, like vitamin C or vitamin D or the antiparasitic?
No, thus far. Nope, we've not used any such things for now. None.
What's been your experience with the normal treatments which are being done right now for COVID, like ivermectin?
So
like vitamin C.
So that's what I presented one case who had taken an antiparasitic and actually created her own cytokine storm because yeah, her lungs flooded up and she actually ended up with the pleural effusion, which was scary. But thank God I stopped it on day 3, which was really good. I still struggle with few who are taking their Chinese medications and ivermectin and whatever they're taking that cause a lot of inflammation in the lungs.
Right, Doc. So the goal of this webinar series is also to educate the population about the kind of harm that these meds are doing. While they may not cause harm to all patients, there are many in whom it can become really damaging. Just last week, there was a doctor in our group. I don't think she's joined our group as yet, but she was a doctor who gave ivermectin to her son who developed severe testicular pain after it. And then we had to treat it. I think you must be remembering that case, right, Dr. Julia? I mean, we've done such cases with pain of the testes as well after ivermectin. And after the high dose vitamin C, we've seen patients who have got bleeding bouts because their G6PD wasn't checked. They have developed pleural effusions as well. After vitamin D high doses, we've seen patients getting severe infections. They've got fungal infections. They've got severe respiratory distress because of it. So I hope that this webinar helps people to understand how intricately we manage COVID, and that you really shouldn't use any of these drugs off-label in that way. Also, do not use corticosteroids unless you absolutely have to, and I hope that I can educate people about how to use them if absolutely required.
Okay, Dr. Tariq, seems that there are participants say they can't hear you clearly, very soft over your place.
Okay, I'll try to speak a little louder. Am I audible now?
Okay, please respond. Other people, can you hear Dr. Tariq clearly?
Is my voice absolutely clear now?
Okay, now it's better. Now it's better.
Okay, fine.
Okay.
All right.
I haven't introduced you nicely, but very brief one. But now we just give the floor to Dr. Tariq. You have to initiate today.
Thanks a lot, Amanda. So I'm going to go on share screen and I'm going to kind of draw stuff as I talk so that you can actually visually see things as I'm drawing them. Okay, so that's my share screen. I hope you all can see it. Okay, this is the way I teach people as well. So let's divide this topic into 4 halves, all right? The first half that I'm going to be talking about is just COVID. And what are these low-dose precision medicines that we are talking about and how they actually help COVID? Considering that there are both doctors in the group as well as non-doctors, I have to keep my talk balanced. So I will talk, some things may be scientific, but I'm going to try to make things as simple as possible. So COVID, as you guys know, is just a viral infection, right? Even influenza is a viral infection. The common cold is a viral infection. But what makes COVID so special that it's creating so much of damage in our bodies? What makes COVID so special is it has increased ability to downregulate certain antiviral mechanisms that our body has. So our bodies are constantly attacked by different types of viral infections. And when we face these infections, our body goes into, or our immune system goes into a phase known as an antiviral state, where it creates certain molecules from our immune system which target and kill these viruses off. But like all viruses have developed ways to suppress the body's immune response. And COVID has been able to do it very well. So it blocks the ability of your body to make these antiviral molecules. These molecules are basically called as interferons. There are different types of them, and COVID affects each one of them in different ways, and it basically blocks them from attacking COVID. So what the low-dose precision medication is, it's a combination of all these molecules which the body should be making, but it's not able to because the virus has blocked them. And we give them in a very, very low dose, which is in a dose of around a femtogram, which is around 10 raised to the power of -15. Now, you'd be thinking that, is this an artificial substance? It's actually not. For example, when you're diabetic, you're given insulin. that insulin is not really an artificial substance because it is made by recombinant technology, which means that you teach an E. coli by putting insulin genes inside it and it starts making insulin. In the same way, you can teach an E. coli to even make all these molecules. And once they are made, we put them as an oral drug and we just give it to the patients to take. So you can give this to a child who's basically newly born. My youngest patient has only been 5 days old, and my oldest patient has been around 101 years old. So you can treat a whole bunch of people. You can even give it to pregnant women as well. Because this is not really an artificial substance. First of all, it's something which is naturally made by your body, and it's given in such a low dose that it's just able to overcome the inhibition caused by the virus. And hence it's able to treat the viral infection out. It's a very complicated science of how these interferons work, so I won't get into them. But it's basically just that. It's a combination of 5 types of interferons and cytokines, which help to not only kill the virus, but also block the inflammation caused by the virus. We have a peer-reviewed published paper in a international medical journal on this. I also have a US patent on this, and it's a very, very effective drug. Overall, just what you heard from Dr. K, that she's done around 300 patients. Each one of the doctors in our group have done around that many patients. Overall, we may have done around 35,000 to 40,000 patients already. And we've not had a single case which has not actually responded. The reason why we need to use certain other homeopathics, which I'll get into a brief amount with you, is because there are many other things which are happening in the patient. For example, in Dr. K's patient, she was having low cortisol. Because the cortisol was so low, she was not able to block inflammation in her body. If we had given her corticosteroids at that time, what they would have done is they would have completely blocked her immune system response, and she would have had worsening of COVID. So we had to figure out a way of how to correct those problems. There are many patients who suffer from vomiting where they end up getting metabolic alkalosis. So we have to correct alkalosis in patients. We have to correct acidosis in patients where the bodies become very acidic after COVID. And because of all these complications, we need to use certain other homeopathics as well. But for around 90% of our patients, even if they just take the antiviral low dose combination, that's enough to treat them. It can also be used as a preventive drug. So if you just take it twice a day, we've had so many doctors in our group who have told us that if they've just taken it twice a day, they haven't actually caught COVID, even though they've been exposed to so many patients. It's completely tasteless and completely harmless to take. So that's the first part which I wanted to talk about, just how we are managing COVID. There are cases, for example, there was Dr. Na who was talking about his own case, and there was Dr. Shah who was talking about her own case as well, where patients end up getting flare-ups of other viral infections. So 90% of our human population suffers from chronic viral infections like Epstein-Barr, CMV. And when you get COVID, the COVID virus helps these viruses start expressing out and dividing and growing. And because they divide and grow, there are a lot of patients who get recurrent fever, where the fever is just not going down. Even after my antiviral combo, the fever doesn't go down. When I just give them my medicine that targets Epstein-Barr, the fever immediately drops within a few hours and the patient has recovered. So this is one other thing that you should be aware of, the fever. If during COVID you have recurrent fever where your fever is just not going down, that means that your COVID is becoming more and more serious. With Omicron, you may not have respiratory symptoms really, but you may have fever, you may have severe body pain, you may have acidity. There are so many of my cases who have no fever, nothing, they just have severe acidity, they have body pain, they have difficulty eating. This is actually a thing known as viral tropism. So I'm going to use this word now, it's a new word. It's called as Viraltropism. And tropism means that the virus, every particular virus has the ability to target certain cells in our body. And this virus, COVID, targets a few cells in our body, mainly your cardiac cells, the cells of your respiratory system, your endothelial cells, which are the cells of your blood vessels, and the cells of your gastrointestinal system or your GI. So that is why patients have such varied symptoms, because virus could affect any one of these tissues in your body which has already been weakened by some other process. So 91% of patients who have COVID ultimately have some sort of gastrointestinal symptoms. And when you take drugs like ivermectin, which is known to actually decrease the vital capacity of your lungs, which means when you're at rest and you're breathing in, you take around 500 ml of air. When you take ivermectin, the amount of air that you take in actually decreases. So you have to use your external muscles of respiration and try to suck air in. That seems like a very small problem, isn't it? But it's actually not, because in COVID, your body is already weak and fatigued. Your muscles are already weak and fatigued. And if you have to use your external muscles of respiration for even around 2 to 3 hours, your oxygen saturation will start to fall. Because of this, ivermectin can actually be a very dangerous drug to take in COVID. Okay? And there's not been any major studies which show that it has clear and defined effects. There's a lot of misinformation about COVID and ivermectin, which shows that ivermectin is very effective in COVID. But actually, if you read the published papers as a researcher, you will find that the effect of ivermectin on COVID is negligible at best, and the rates of side effects of it are pretty high. Okay, this is why the medical community as a whole says do not use ivermectin. Of course, there are many patients who have taken ivermectin and have benefited by it because it does have some antiviral effects. But that doesn't mean that it should be used by every single person, and it doesn't mean that it's going to protect you against COVID if you take it as a prophylactic. The next drug that I'd like to get into is a drug called as vitamin C, which I'm sure you've all heard of. Vitamin C is both an antioxidant as well as a pro-oxidant. At a dose of around 2 grams, which is quite a very minor dose, it will work as an antioxidant. And at a higher dose, it works as a pro-oxidant, which means that it starts burning your body. At a high dose, vitamin C is very effective for bacterial infection because you require oxidative stress to burn and kill a bacterial infection. But at a high dose of vitamin C, when it increases oxidative stress, that is actually detrimental to a viral infection. Because in a viral infection, you do not want any oxidative stress to form. This is a very important concept to understand. We've had many patients who've been given high doses of vitamin C above 2 grams. They've been given 10 grams, 15 grams. It's very dangerous. Because not only will it increase oxidative stress and cause you pleural effusion, which means fluid can start building up in your lungs, but it can make your COVID far worse. We saw a case last month where a patient was given vitamin C and started having severe blood in the urine because there is an enzyme called as G6PD, which you need to check before you give a pro-oxidant. The test for G6PD takes around 3 days to come back. So usually the doctors who are giving these treatments of vitamin C are not really checking it. They give the vitamin C without checking the G6PD. The patient gets severe bouts of bleeding and could even die with it. So do not use high doses of vitamin C if you get COVID. The third drug which is being used is vitamin D. While there are several published papers that show that vitamin D is very useful in COVID, you need to be aware because if you have kidney disease and your phosphate levels are already high, if you take vitamin D in higher doses, your phosphate levels will start to increase in your body. And as your phosphate levels start going up, it will affect your lung function, where you will start deteriorating in your lung function. It will also cause your RBC counts to start tanking. It will cause your hemoglobin counts to start tanking. And because you start becoming anemic, you can start becoming worse. So before taking vitamin D for COVID, it is really imperative that you check your kidney function. If you are diabetic and you're taking high doses of vitamin D without checking your kidney function, please be aware. For most patients, vitamin D is relatively safe when you take it around, say, 6,000 or 10,000 IU daily for maybe 5-6 days. You can still take it for COVID. But if you have kidney function, please be aware. Okay. So we've covered ivermectin's problems. We've covered vitamin C. Please do not take vitamin C above 2 grams. Anything above 2 grams would be highly detrimental to you. Vitamin D, you can take it, but make sure that if you have kidney disease or your creatinine is elevated, do not take it at all. The last one that I'm seeing that is being used quite often is things like steroids. We've also seen patients taking large doses of omega-3, which can also be damaging. Let's get on to steroids. Oh, I forgot zinc as well. So there's this whole group of doctors who are saying that we should be giving steroids to patients. And what they basically tell you is you have to count the days on your fingertips. So you count day 1, day 2, day 3, day 4, day 5, day 6, day 7, day 8. And on the 8th day, you blindly start a corticosteroid. This is super silly to do. And let me explain why this is so silly to do. Corticosteroids are inhibitors of your immune system. They block your immune system from functioning. If you have a viral infection and you block your immune system from functioning, the virus is going to spread, which is why if you give steroids to a patient who's actually fighting the virus out very well with his immune system, he's going to get worse. But why is it that so many patients are given steroids when they land up in the hospital? This is because when your immune system has crossed a certain point where it can no longer fight the virus, it starts going crazy. It basically starts throwing what is called as a tantrum. And that tantrum is what we call medically as a cytokine storm. So if your patient starts having, or if you as a person start having a cytokine storm, and I will be explaining shortly how you can make that out. If you are having a cytokine storm and your oxygen levels start to drop below 88%, it is only then that a steroid may be indicated. And it still doesn't mean that you should use it. It's only it may be indicated. I have explained in my videos on COVID as to exactly when a steroid should be used. But from a general perspective, only if your oxygen is less than 88% should you even think about using a steroid. And when you do use a steroid, do not use in high doses, use it in pulse dosing, which means you give 2 doses and you wait and you stop. Do not give it continuously, otherwise you're going to completely inhibit your immune system. If you are a diabetic or you are hypertensive and you take a steroid, it's going to pump your glucose very high. We've had several cases who are completely healthy, had mild amounts of COVID. They took steroids based on these protocols and they landed having severe heart attacks because the steroid increased their blood sugar to around 400, 500, started causing clots in their blood vessels. And that's how they landed up getting those heart attacks. So please be aware of taking steroids as well. Omega-3 sounds like a pretty harmless thing, right? But if you read published papers on it, you'll find that even omega-3 in high enough doses, let's say you start taking 3 grams a day because you're scared of COVID, you will end up getting fatty liver disease that starts causing liver damage. So even omega-3 could be dangerous in these high doses. What about zinc? They say that you should keep taking a lot of zinc if you have COVID. Zinc triggers the growth of fungal infections. When we see patients with COVID, what I've taught doctors to do is basically just ask the patient to stick his tongue out. And all the patients who have been taking zinc, when they stick their tongue out, they have a thick coating of fungal on the tongue. Why is fungal so bad? Because it's going to make you fatigued. The fungal infection is going to cause you tremendous fatigue. Also, if your patient already has some sort of vascular injury in his brain, zinc actually leads to further aggravation of vascular damage in the brain and even leads to dementia. So again, we've seen several patients who were on zinc who landed up getting dementia after COVID. And when we simply stopped the zinc, their memory function started to come back. Basically, the point I'm trying to make that all these treatments which have been told to you for COVID are not really indicated, and there's not enough of scientific evidence which backs it up, and they could cause you severe detrimental damage. So please don't do it. There are a few chats which I'm going to try to look into and see if I can answer them. Okay, let's see in the question and answer. Yeah, so the first question is what can we do to improve smell, which is in post-COVID, which I'll talk about. Is there any other questions in the chat? You can just ask me. Selenium, there's a question on selenium. There's no real effect that selenium would have on COVID. So you could take selenomethionine if you have some thyroid disease, but against COVID, it doesn't have much of an effect. Okay, so I hope you all have at least understood this about the damaging effects of all these treatments, and also understand that all we are doing with our low dose medications is giving substances which are naturally made by the body and which the virus is blocking in order to kill it off. That's all we are doing. let's get into the next section, which is our major topic, which is MISC. The entire reason why we are holding this webinar series is because Dr. Shah's child was developing this, and because of the help that we gave her, her child was able to recover. And basically, she's the one who requested that we do this so that people become aware of it. So what is MISC and what happens in it? If you have children, please listen very carefully, because this will help you to save your child's life and help you to identify when the problem is happening and how to go about treating it. So let's explain this by drawing a graph. Okay, fever is the first thing that will happen when your child starts having MISC. And let's draw this little escalating scale here. This is the scale which shows inflammation in your body. And as inflammation progresses, the child's symptoms become worse and worse and worse. At the lower end of the spectrum, the first symptoms that happen of gastrointestinal are GI distress or gastrointestinal distress, when your inflammation is somewhere around here. As inflammation progresses, the child will develop arthritis. As inflammation progresses further, they develop cardiovascular disorders. They can develop aortic aneurysms or coronary aneurysms. As it progresses further, they develop something known as macrophage activation syndrome. And as it develops further, they end up getting shock. So MISC was coined because children were having symptoms which were not particularly Kawasaki disease. Again, there's another word which I'm using called Kawasaki disease. And because these children were neither having full-blown symptoms of Kawasaki, nor were they having full-blown symptoms of macrophage activation syndrome, this word of MISC was coined, which is multisystem inflammatory syndrome happening in children. I'm going to try to explain inflammation to normal people who are not doctors, as well as to doctors, both alike. So just imagine that you've taken some wood and you've put it on fire, right? It starts burning into a giant flame. That is inflammation. And the purpose of that giant flame that comes in is to burn out the source of infection. So this is what your body does. It takes, when a virus enters, it creates this massive amount of inflammation, where it starts using heat, energy, and inflammation, trying to drive the infection out. That's why you have fever. But this should be a controlled process, like a controlled burn. For example, you want to cook meat on your flame. If you put a lot of wood, you're going to burn that meat. So hence you control the amount of flame that is put on. When the control mechanisms for this inflammation stop working in a body, that is when prolonged inflammation or smoldering inflammation happens. This is almost like, the wood has now been burnt out and there's just that charcoal which is smoldering inside. It is a smoldering charcoal which I'm talking about in terms of inflammation. How do you know this inflammation is happening? We can understand it by the symptoms of the patient and via blood reports of the patient. We can understand it by looking at a simple thing known as a CBC, which is a complete blood count. So if you look at your complete blood count, you find that your total white blood cell count, which is known as a TWBC, is high. Or you find that your neutrophil count is high and your lymphocyte count is low. That's the beginning of inflammation or a cytokine storm which is happening. You can also notice it by looking at your CRP levels, which may be high. You can look at it by looking at your D-dimer levels, which may be high. Again, you can look at the levels of ferritin. And if these levels are all high, that means you're having severe uncontrolled inflammation. For most patients with COVID, all these are elevated for a short time and then your body brings it down. But if these levels continue to rise, you're having chronic inflammation. So this is just about inflammation. Now, what is really MISC? So usually children who develop COVID will end up having mild symptoms because even with Omicron, it doesn't really cause severe symptoms in children. But after a week of recovering from COVID, or even up to 2 weeks or 4 weeks after recovering from COVID, your child can again develop symptoms of fever. That is why fever is a hallmark over here. Why is this happening? As I had explained to you before, there is viral tropism. So this virus has entered inside the cardiac cells of your child, or entered inside the blood vessel endothelial cells or your gastrointestinal cells. And after COVID has gone, it's no longer really dividing. So you're just sitting quietly inside these cells. And your body has made a lot of antibodies, right? It's made all these IgG antibodies trying to target this virus, which is why after your child has recovered, when you do an RT-PCR, you find it's negative. So your body's antibodies have removed most of the virus, except that one few little bit of cells which are stuck inside your cells of your cardiac tissue or your endothelial cells. After a week to 2 weeks, as your antibody titers rise, some of these antibodies start to target your cells which are holding this virus inside. This virus is no longer replicating, it's just sitting quietly inside. So it is not really the virus which is causing the damage here. It is now your own body's immune system attacking that virus. Okay. And when it starts attacking the virus, the first bunch of symptoms are in the gastrointestinal tract, or that is the stomach, the gallbladder, and your intestines. So most of the children, after recovering from COVID, within a week to around 6 weeks after COVID, they start having gastrointestinal symptoms. These can be in the form of diarrhea. So your child will have sudden bouts of diarrhea. Okay. It can be in the form of hydrops of the gallbladder, where the gallbladder starts to get a lot of fluid and swell up, which will cause severe vomiting in your child. Okay, will cause diarrhea with severe vomiting. Stomach pain can start happening in the child because the gallbladder starts swelling up. Okay. It can start causing asthma in the child. Why asthma? Because the virus has caused severe acidity. When the child is lying down in the night, and this is very peculiar, the moment the child lies down, the stomach acid, which is forming in such high quantities, ends up coming back up in the child's throat, and some of it enters inside the lungs, and the child develops severe cough. So the parents of these children, when they call me, I ask them, is your child's cough or asthma getting worse while lying down? And if the parent says, yes, my child's cough is getting worse on lying down, his nose is getting stuffy and blocked, worse when he's lying down, this is a symptom of MISC. We had several parents, most of them doctors, who have been calling me and asking me about how to treat their children when the child has developed these symptoms. These children were mostly given corticosteroid inhalers, pumps, cetirizine, but the problem is that it doesn't solve the problem completely, because it is not actually targeting that inflammation in the child's body. So 91% of all children who have MISC will just have gastrointestinal symptoms, okay? Which is again asthma, stuffy nose worse on lying down. They will have diarrhea, stomach pain, and severe acidity bouts. They will not be able to eat any food. When this inflammation progresses and it becomes more and more, again, the child is remember, forming a lot of antibodies. There's no replicating virus. The antibodies are binding to the cells in their body and creating massive inflammation. If it increases, the child may develop swelling in his legs, swelling in the limbs, and they may start having joint pain. This can happen in adults as well after COVID and after vaccination. Many of my patients have developed severe arthritis after this. When this progresses further, it can lead to cardiovascular damage. In cardiovascular damage, it causes aneurysms in a child. And why does it affect children and not adults? Because the child's aortic tissue, or the aorta, has a very little amount of elastin in the lamina, or the vessel wall has very little amount of elastic tissue, which is made by the protein elastin. So when inflammation hits this, it can cause damage, and the aortic tissue actually forms like a balloon over here. This is bad because the wall of the aorta then is damaged, and it can lead to sudden bleeds, which could happen because of it. If this inflammation continues to happen, your child will develop macrophage activation syndrome. In this macrophage activation syndrome, We identify it because when you look at the child, you can clearly make out that the child is having this. Their limbs become swollen, their legs and their hands become swollen because there's so much of cytokines which are being released. And you can make this up because the neutrophil count will go very high, the lymphocyte count will be dropped very severely. The child will have hypoferritinemia, where the ferritin will go sky high, CRP will go sky high, D-dimer will go sky high. So everything is swollen in the child's body, and the child may have severe cardiac pain, will have difficulty eating any food, the whole face will become swollen. If you still don't treat at that time, the child may end up having shock, which means that the blood pressure will dramatically fall because all the fluid is gone out of the body. Now, where does this fit into Kawasaki disease? This fits into Kawasaki disease because primarily in Kawasaki disease, there are certain features that you need to look out for, which means that you need to have exfoliative dermatitis on your hands. So the child's hands will become all red and the skin will start to peel off. You need to have this maculopapular rash all over the body. So the child's body is filled with rash. The eyes will become bright red because there is conjunctival inflammation. The tongue becomes red and they start having chest pain and they start having aortic aneurysms. But because only 20% of the kids would have this classical Kawasaki, what about the rest of the children who were just having GI symptoms, who didn't have the rash? It is for them that this name MISC was coined. So it's basically just a subset of patients who have Kawasaki disease who did not have classical Kawasaki disease, which is why, again, this term was coined. Now, it's very important, again, that I answer questions which have been asked before I proceed. So let me see if there are any chats. Okay, so the first question is about, I wonder if the FLCC protocol is a conspiracy where it will lead to storm inside the body. The FLCC protocol, when you look at it on paper, is a pretty complex bunch of things where they are trying to target inflammation by using corticosteroids, but it's a flawed protocol because now the recent published papers on steroid use for COVID as well have shown that rather than decreasing death rates, corticosteroids actually increase the death rate. So you shouldn't be using them. It is a protocol which was made many generations ago in terms of, this was a long time back when the Delta strain was there, when we didn't have enough information about the trials which are now being done. And it's a very old method of treating and it really shouldn't be used at all. Green tea powder, I have no problems with it because it decreases inflammation, so I don't really mind it. Can the antiviral combo decrease the spike protein and graphene? So there's no real evidence that Pfizer has been putting graphene in their vaccines. I can't really answer that. In terms of the spike protein, the antiviral combo is just allowing the cells of your immune system to go and destroy the virus. So by making interferons like interferon beta and interferon gamma, your body is able to actually go and cut the virus RNA down into its bits and destroy the virus naturally. So it's not really specific for the spike protein, but it's just destroying the entire virus. And at the same time, it's decreasing inflammation created when the body cannot remove the virus naturally. So it's like a child throwing a tantrum, the child wants a certain toy, which is like your immune system wants those interferons to be able to remove the virus. And when it doesn't get those interferons or gets the toy, it starts throwing a tantrum. And the tantrum is the cytokine storm, which is your body is using the wrong method of trying to remove the virus. It's using a completely faulty mechanism trying to remove the virus. And that is exactly what the cytokine storm is. It's a faulty method of removing the virus because what the body needs is not being provided. Next question is, I'm 77 on supplements, zinc, omega-3, vitamin C, D. None of these are recommended. Doing more harm than good? Absolutely. If you are taking them, there's a lot of stuff that you should be looking at. I will give you an example of a patient of mine who's having mild blood pressure, very mild. And he decided to take omega-3 because he heard that it was good for blood pressure. He started taking around 3 grams of it a day. And when he came to see me, he had severe acid reflux. I did not know he was taking omega-3. And when he would palpate his liver, he would complain of mild pain there. So I got an ultrasound done, and what I found was severe fatty liver. He didn't have fatty liver disease 3 months before, but all of a sudden he has developed fatty liver disease. We stopped omega-3. The moment we stopped it, within a few months on its own, the fatty liver started to correct. If you can Google it, you can put omega-3 and liver disease on Google, and you'll find published papers showing how omega-3 actually in high doses can lead to liver damage. Some feedback from patient using nasal prong more comfortable compared to venti mask. When start using VMAS, they say more difficult to breathe or cannot breathe. In that case, how doc? I'm not really sure what the question means. I mean, if they are wearing a mask, maybe it's difficult for breathing because there's not enough oxygen flow, and some patients are maybe could be claustrophobic. But usually a V mask would be much better than just using a nasal prong because there's more oxygen going in at a time. Could Kawasaki disease happen in adults too? Well, we've actually seen one case of a doctor in South Africa who was having this peculiar symptoms of Kawasaki's. It's really strange. There's no lesion in the mouth, but the hands have severe exfoliative dermatitis. The legs were completely swollen and was in severe pain. So this is one of the cases where I've seen something happening on the hands in terms of this exfoliative rash, but there was no heart disease. And because there was no heart disease, I wouldn't really call it Kawasaki's, but something like that was happening in her. There is MISC-A as well, where there's multisystem inflammatory syndrome, which affects adults too. And even in adult patients, they can develop this severe prolonged inflammation after COVID. The initial sign, remember, is fever. After COVID, you recovered and all of a sudden you get fever and then all these symptoms start to happen. That is definitely MISC. So if your child has recovered from COVID and he starts getting like asthmatic symptoms, but he didn't have a fever, then that is not really MISC. But if he did develop a fever after recovering, then that is usually MISC. Dr. Su is saying, so keto diet is not good as it's high on fat, even healthy fats, as liver may not be able to metabolize fat. So keto diet could be harmful if you're already dehydrated. So let's say your patient had COVID and was having severe bouts of MSS. They were vomiting. They were not able to take any food in. And if they were not able to take in food and they were already on a keto diet, the ketones may be pretty high, which then can cause them severe acidosis. So it's not about the fat metabolism you're in the liver. If you're on a keto diet and you have COVID, you may have ketosis, you may have severe acidotic states in your body, which will not really be helpful for you. So everything should be done in moderation in COVID when you're trying to treat it. Really look at your case, think about what's going on before you start any treatment. Don't take this protocol and just stick it onto every patient. It doesn't work. Every person has different levels of inflammation and different types of inflammation. I have a COVID course, which is almost 9 hours, where I explain every single thing in a great amount of detail. Because I'm short of time, I can't really explain the whole thing. Still, if you have any questions to ask. Let me see in Q&A as well. There's one question that my daughter and I had COVID last May. We still experience weird smell from time to time and prolonged headaches. What can we do to improve our state? So what you can do is contact Amanda. She'll help you to figure out how to get the meds and how to treat them. This weird smell, is called as parosmia. We've had patients who, when they eat food, all food smells like garbage. Is that what you're talking about? Because we've had several cases, not just with lack of smell, but with this parosmia. Every single thing that they eat smells like garbage. Now, the etiology of this is there is a paper on this where it shows that the virus actually lingers on inside the connective tissue, which is around the olfactory nerve, and it continuously triggers smell receptors in the brain. And it's almost like a form of olfactory epilepsy, which it creates. So you start having these weird smells continuously. And it also creates these severe debilitating headaches. So please contact Amanda so we can run a few labs on you to understand what's going on and then actually tell you of what you can do to help yourself. Dr. Susan is saying, I had COVID since Monday, but no fever, had sore throat on day 1, but day 2 was gone, had cough. Yesterday a PCR test and still positive. No symptoms. What should I do? She's 63 and had a booster dose. So if you're asymptomatic with COVID and you don't have fever, basically what you could do if you really wanted to check is run your labs, do a CBC, do your D-dimer, do your CRP. And if your labs are normal, you can just relax and let the virus heal on its own. Any use of using high doses of vitamin C, I've already explained that the higher the dose of vitamin C you give, the more oxidative stress it's going to create. We have many doctors I've seen who use high doses as a form of bravado. There is no need to be brave here. So one doctor says I've used 10 grams, the other says I've used 15 grams, the third guy says I've used 100 grams. Well, why not use 1 kg of vitamin C in a patient? There's actually no use of it whatsoever. It's just going to increase oxidative stress, create a burn without actually enabling you to remove the virus. Oxidative stress does not work in viral infections, only in bacterial infections. So there's no role of high dose vitamin C. The only thing that I can think of why you would want to use vitamin C is because vitamin C increases a type of interferon known as interferon beta. But in my antiviral combo, we already have low doses of interferon beta, which is sufficient. You don't need to use vitamin C extra at all. There was a first question also about mixing vaccinations for a child. So in UK, they are actually mixing vaccines. They're giving Pfizer with this vaccine and that vaccine. And also, if you look at Pfizer's data, so the question was Pfizer has more than 1,200 effects. Now, you've got to look at this data from perspective. So Pfizer has not claimed that these side effects happen after taking the vaccination. They are saying that they noticed that these side effects were happening when the patient was given the vaccine. That doesn't actually mean that there's a causality there from Pfizer's perspective. Okay? Even if you are a medical regulator and you see this, you could simply say that since it was tried on so many thousands of patients, some of these people were already having these symptoms or they were having a baseline disease and it worsened after it. So according to Pfizer, there is actually no connection between the side effects that they have seen and their vaccine. But in practice, of course, we've seen patients having Sinovac having side effects, having Pfizer having side effects. So you really can't tell which vaccine is so-called safe for you, because you really don't know which one is going to cause you issues. If you have taken one vaccine before and you've had no side effects of it, better to stick to the same vaccine. But if you've taken that vaccine and you've developed side effects, better to shift to a different vaccine or not take any vaccine for that matter. Besides Pfizer and Sinovac, there are many other vaccines which are there, which are even available in India, which do not follow this method. So they are protein-based vaccines, which are also now available, which are deemed really safe. So if you don't want to take Pfizer and you don't want to take a vector-borne vaccine, you can also take the protein vaccines, which are now available. See there any other questions? Okay. The first one is, does sleeping face down help? Yes, it does help. So in patients who were having Delta strain because they were having respiratory distress, by lying on their belly and breathing, it does help. Next question is, do we have regular classes? Yes, we do have classes which you can join. How about chlorine dioxide or MMS? So MMS will trigger diarrhea. If you have used it on yourself, you know that it can trigger diarrhea. And also it's an oxidative agent, so it's really useful in bacterial infections, and it may not really be helpful in any viral infections. There is a book on it called, I forgot who was the inventor of it, but he has a small book on it. And if you read that book, he pretty much states that it should not be used in viral infections, even though he has mentioned some role of it on HIV. He has mentioned that it should not be used on viral infections. It can cause severe diarrhea, so be aware. Okay, coconut water, yes, it can help. Coconut water is helpful whenever you have a viral infection. The first thing that was taught to us in medical school is in a viral infection, you just need to give supportive treatment, which is basically just like anti-inflammatory drugs, like an NSAID or like a paracetamol. And you just have to keep hydrating the patient because the patient is losing fluid at that time. So hydration is very required, and coconut water would definitely help, not a problem at all. A friend has been having severe depression after the second vaccine. What can we do to help you? Yeah, so I will talk about Immucil in a small brief. And we've had several cases who have depression after taking the vaccine, and it is Imusel which helps to treat that depression in these patients. One more question of patient is a hepatitis B carrier. Can the COVID vaccines worsen the liver? We're not really sure whether the COVID vaccines can worsen the liver. There's been no paper that shows that the liver inflammatory enzymes increase after taking the vaccine. So I can't really answer that question if it can do that. So Dr. Kaur is saying after the second and the third vaccine, the enzymes went sky high, previously all good. So it can happen, as I said, that your patient with your enzymes of your liver could go high, but unfortunately there's been no documented evidence to show that it happens. But as I said, it can affect any tissue of your body. The vaccines can cause it. We've typically seen patients after taking the vaccine having severely high CRPs. We've seen a patient having a CRP of more than 250 after taking just the vaccination. He was asymptomatic, but his CRP was very, very high. So if your inflammation goes high, of course, it can cause damage to your liver. Also, which of the enzymes went high? If it was AST and ALT, that means you're having hepatocyte injury. If it was enzymes like ALP and GGT, that means you're having biliary obstructions and you were having blockages in your gallbladder, which could have happened after taking the vaccine. So again, which of the enzymes went high would really matter to understand what the vaccine is doing. All three were high. That means it was affecting your gallbladder. It was affecting your hepatocytes as well. So if you can contact Amanda, please contact her and take my antiviral combo to make sure that the vaccine effects goes off. One more question is, after the Pfizer booster, they get eczema. So yes, Dr. K and I have treated hundreds and hundreds of cases who have developed eczema. I'll just give you a small brief of it. So we've treated patients after COVID and after the Pfizer vaccine who have developed eczema by treating Epstein-Barr. That's one half of patients, where when we start treating them for Epstein-Barr, the eczema goes off. So it's a viral eczema. Then we've treated patients of post-Pfizer eczema by using a toll-like 2 receptor antagonist, which blocks a certain factor, which is hit by the vaccine in the body. So by down-regulating it, we kill off the eczema. The third types is we've used a homeopathic which upregulates IgA, which can also treat the eczema. So how we treat this eczema is by simple questioning of the patient. For example, if your patient has eczema which is burning in nature and they have swelling in that area, then we give them a homeopathic called Thuja, which targets IgA. If your patient has eczema and when he's applying cold on that lesion, it's feeling better, that means it's a toll-like 2 problem, and we give a homeopathic called sulfur. And if your patient has clearly viral-looking eczema, or they have had herpes in the past, or they've had lesions in the mouth, then it's usually Epstein-Barr, and we treat them for Epstein-Barr, and the eczema goes on. So we're kind of careful about how we separate these eczemas out, and then we treat based on the type. Yeah, so there's one question on gut and would probiotics help. So there's an interesting paper that has been published, I think 2 months ago, about the role of probiotics in patients who've had GI upsets with COVID. And there is some role of certain probiotics, like if you take lactobacillus, in some patients it has helped them to decrease inflammation. But again, it doesn't actually cure it out because the inflammation persists and continues after the probiotic is withdrawn. So I'm going to get into the cytokine milieu or the cytokine inflammation which is happening in COVID, and maybe then I'll be able to answer this better. One question is, can someone with thrombocytopenia take the booster? If your thrombocytopenia is because of, say, dengue, that you've just recovered from dengue, or it is because of, say, you have some sort of autoimmune disease, or you have liver disease, then you really should be aware before you take the booster, because it could make your condition worse. So we need to know the source of the thrombocytopenia. I do not know how to answer that, or what blood level of platelets is safe actually for taking the booster, because we don't have any evidence, or we don't have any data that backs it up. Joint pain and bone pain after COVID is very simple to treat. We just give my patients Imucil and my glutathione, which is actually glutathione, which is orally absorbable. We give that and we are able to treat. Okay, so there are lots of questions which are coming on COVID. I'm going to find it difficult to answer that, and then I won't be able to proceed. Let me explain what the cytokine storm is and how we identify it so that you can understand these things. Okay, so let's go to what is the cytokine storm really. Again, so I'll re-explain this. When your body doesn't have the means to fight COVID, which are the antivirals that it makes like interferons, then it starts throwing a tantrum and uses other means of fighting the viral infection. One of the cells it uses to fight the viral infection are called as neutrophils. And these neutrophils are the ones which create oxidative stress. As I was saying, oxidative stress is bad in a viral infection. And you don't want it to form, because if you get oxidatively stressed, your blood sugar will shoot up, your body will start becoming swollen, acidotic. But then why is your body using neutrophils in COVID? Ideally, your body should be making interferon beta from your infected cells. So these infected cells, which are the cells lining your mucosa, they should be making this interferon beta, they should be making interferon lambda. They should be doing it. But when the COVID virus hits you, it basically inhibits the formation of these. Okay. Now it is left to the white blood cells which are there in your body, which are there in your blood to fight it. So let's explain this in one other way. Say these are your cells which are lining your tissues of your nose or your lungs or whatever. And then you have all this connective tissue which is here. And then you have your blood vessel which is supplying blood to this tissue. So your virus infects this area, okay, and it's now trying to spread. The moment it infects this cell should actually make these antiviral agents and destroy this virus out. But because it's not able to, now a cry for help goes to the blood vessel. And the blood vessel starts dilating, it becomes large in size. It starts having holes inside it, or small little spaces open up, not holes. And all the contents of your blood, your white blood cells, start to leak out. These white blood cells are known as neutrophils, macrophages, and you can even have lymphocytes which come out. The major cells here are your neutrophils, these neutrophils. Now these guys also end up making some interferon beta. So it's good and it helps to kill off some of the virus, which is why in COVID patients who are recovering will find that the neutrophil count is slightly high. When they make too much of oxidative stress, they will cause burning off of the tissue. Now, what should the neutrophil ideally do? It should make the little bit of interferon beta, help to kill off the virus, and it should, in that time of about 6 to 7 days, this lymphocyte which is present in your blood, which I've also said comes out, which are your B lymphocytes, your T lymphocytes. Okay, these are the ones which actually are the ones which are like trained assassins. They go inside your tissue. They already know this is the COVID virus, and they attack and kill off the COVID completely and totally. These guys should be doing the job. And these guys take around 7 days to wake up. They come out from a slumber after 7 days. In those 7 days, the neutrophil is going gaga and trying to kill off the virus. But this virus has an ability to even block the formation of these B and T cells. So after 7 days, if your B and T cells don't wake up and they don't fight off this infection, now the job is just left to the neutrophil. So this guy, he increases in number and tries to kill off the virus. And by doing this, he increases massive amounts of oxidative stress. And when this happens, your tissues start to burn, they start to break down, they start to die. Okay? This is what uncontrolled inflammation is. And how do we make this out? This is happening very simple. You simply have a CBC. In that, you check your total white blood cell count, it will start going up. Your neutrophil count will start going up, and your lymphocyte count will start going down. When you see this picture, you know that you are having a cytokine storm. These neutrophils, besides secreting oxidative stress, they start secreting these substances called as TNF alpha, IL-1, IL-6. These substances end up going to the liver and start inflaming the liver. So the liver starts making inflammatory proteins like CRP. This TNF starts clotting the blood, so your D-dimer goes up, which is a marker for clotting. And it starts causing another protein called as ferritin to go up. Why this ferritin? It's a iron binding protein. It holds iron inside itself. And when your neutrophils make oxidative stress, they do it by burning iron. So it's like iron combines with oxygen and creates this oxidative stress. So in order to stop it, your body increases the level of ferritin to hold that iron in to prevent the neutrophil from creating a burn. So if the ferritin levels are up, that means you have severe oxidative stress. If the ferritin levels are normal, that means your oxidative stress is not much. So the simple test for oxidative stress is just check your ferritin levels. That's all. We've seen that after taking high doses of vitamin C, the patients get severely elevated ferritin levels because his oxidative stress has increased to a massive amount. So this is as simple as possible. It doesn't require much of thought. You just need to get your total white blood cell count tested, neutrophils, lymphocytes, check your ferritin, CRP, and D-dimer. And if they are elevated, that means you're having inflammation and you need to target that inflammation. Okay. What are the medications that we have? We have this low-dose antiviral combo that we have. We have a medication which is a lymphocyte elevator, which increases your lymphocyte count and decreases your neutrophil count. We have an antioxidant called as clotho, which helps your lungs, your alveoli of your lungs start to repair and heal themselves. So by giving all these things, we are decreasing oxidative stress and we're helping your body fight against this virus. And depending on what stage of inflammation you have, what type you have, we are able to then give you specific treatments which are tailor-made just for you. Okay, the only thing that is standard is the antiviral combo. Everything else is tailor-made for the patient. What is this Immucil that I've been talking about? Let me explain that as well. So Immucil is basically like a polyherbal pill that we've made. It's a combination of 3 herbs. The 3 herbs are, one is amla, which is rich in vitamin C. But when we make it in a powdered extract, there's no vitamin C left in it. It actually has certain tannins, which have the ability to kill off the virus. So we have amla and we've made a certain extract of it, which has those molecules present in it. Then we've used a herb called kutki, which helps to decrease the enzyme NOX2. So as it inhibits or blocks NOX2, the ability of the neutrophil to make oxidative stress drops down and the neutrophil can no longer create that burn in your body. And because of it, it will then bring your ferritin levels down. Third herb is called as Tinospora, also called as Guduchi. And this one has direct ability to increase the antiviral state. So our published paper on this again is a peer-reviewed international paper, which shows that within 2 days of giving Immucil, 71% of the COVID virus was eliminated. NOX2 was completely inhibited, and by blocking it out, the patient who had almost a negligible increase in oxidative stress. The third thing that it blocks COX2 as well, which is the enzyme which then causes further inflammation in the body. It causes damage to your cells of your kidneys, your lungs, all these other organs start getting damaged because of COX2. So it's a strong inhibitor of COX2. And the last is a direct inhibitor of all these inflammatory cytokines, TNF, IL-1, IL-6. Now, when we started giving Immucil to patients who have got long COVID, that means they have had COVID, and after COVID, they have chronic fatigue, headaches, lack of smell, all these things. These patients started to improve dramatically. Within a span of a week or so, the fatigue would completely go off. And when we would check the levels of inflammatory markers like CRP, D-dimers, which are always elevated, these markers will start to drop and the patients would improve. None of the patients who started taking Immucil ever stopped it. So when we started asking them, why are you not stopping Immucil even though you've recovered? What you would get is that it is dramatically improved our fatigue, because it is NOX2 which basically causes fatigue in the body. So their fatigue levels would dramatically improve and they would start losing abdominal fat. The reason why this happens is because abdominal fat happens due to insulin resistance. And insulin resistance, where insulin doesn't work in your body, again is caused by increase in NOX2. So as you block NOX2, you actually start losing abdominal fat. And because of course, the fat around your abdomen has gone down, your belt buckle starts to go inside further, you're able to burn more fat in terms of energy. So your fatigue levels start to go down and you become more energetic. So by actually making Immucil for COVID, we found now that it's very good for this weight loss, not weight, but waist loss. It helps in diabetes. So Many of our patients who develop severe diabetes after taking either the vaccine or COVID, their blood sugars are stabilized within a span of a month to 3 months, and they no longer require anti-diabetic drugs. In terms of what its effect on diabetes is, Dr. K has done so many patients of cancer as well as diabetes by using Imucil. In cancer patients also, there is tumor-mediated inflammation which occurs because of these substances being triggered by the tumor. And as you block them out, it enables your immune system to target the cancer and kill it off. In terms of diabetes, new onset cases, it works very well. In old onset cases where the diabetes has been since many years, which means that the pancreatic cells are dead, it still works, and it works by decreasing that abnormal fat. And as the fat decreases, the patients become more energetic and they start being able to burn their fat off. So this is how Imucil works in patients with long COVID. As I said, we have a peer-reviewed published paper of just Imucil on COVID as well as long COVID. You can check that out on PubMed. It's called as Imucil, IMUSIL. I spelled it wrong before. You can just put my name, Dr. Tariq Jagmag, on PubMed, and you'll find that paper. So just put in plus PubMed, and you'll find the publication for exactly how it works. So in conclusion, what I would like to say before I get into each one of the specific questions is that in COVID, all you need to do is to basically just give supportive treatment. Make sure that your fever goes, and don't make your fever go by taking high doses of paracetamol. When I say supportive treatment, I mean just minor doses of it, okay? Maybe like 500 mg once a day or twice a day, that too only if your fever crosses 102. If your fever crosses 102 or is more than 102, only then take paracetamol. If you take it when you have low-grade fever like 99 or 100, you're not enabling your body to create that antiviral state by getting a fever high enough to fight off the virus. Why do you take it if your fever is more than 102? Basically means that your brain is getting heated up if it's more than 102, and you don't want your brain to become too hot. That's why you take a paracetamol. That's all. Drink enough of fluids when you have COVID because you're going to get dehydrated. If you have vomiting or if you have diarrhea, that's a severe problem because when you're losing fluid, you're undergoing acidosis or you're undergoing alkalosis. Either acidotic states or alkalotic states can happen. You need to continuously take in electrolytes to make you better. Even for Dr. K's cases, I've repeatedly said just by giving electrolytes to the patient helps them so much. If you take any drug like ivermectin, and now there are a whole bunch of other antivirals which are out in the market, if you take any one of them and you end up getting diarrhea or acidity, please stop the medication because it's making you worse and worse and worse. Okay, so don't take those drugs. Don't take high doses of vitamin C, vitamin D, any of these things in high doses. Definitely and totally not worth doing at all. Our antiviral combo is simply oral. You can give it to any patient, whether they are newly born, 5 days old kids, or they are old at the age of 101. Any age can take it. It's completely safe. And within a few hours of taking it, the fever level drops and the person improves. If you have a child who develops MISC, the first sign you should look out for is your child will have fever after recovering from COVID. 1 week or 6 weeks after COVID, they end up getting a fever, end up getting stomach pain, symptoms of asthma, diarrhea, gallbladder inflammation. These are all the symptoms. How do we treat it? Really simple. We give them my antiviral combo. We give them another medication, which is again low dose called Emetine, which again is antiviral, but in a different way. And we give them some homeopathics. Nux vomica, this stops the stomach pain. Antart, this stops the cough of the patient. And that is all that we give. So we just give Nux vomica, Antart, antiviral combo, and Emetine. And that is all that is required to treat the patient. If your child ends up getting heart inflammation or myocarditis, then the drugs required will be different. So we can give drugs like Apis. We give drugs like Naja. These are the ones which control complement activity. Complement is another part of your immune system which is involved in this crazy inflammation that happens. So by giving both of these together, we turn the inflammation down. Okay. If your child is having macrophage activation syndrome and they're having full body swelling, Then the best drug that we found is a drug called calendula. This is a drug which enables the macrophages to actually go and eat up all those enzymes which are made by the neutrophils, and this brings the complete swelling down in the body. So calendula is a great drug for macrophage activation syndrome. Okay. Now, what are the features of these children who develop MISC? What they have found in what has been published is that there is no correlation between the viral load that the child had and the risk of developing MISC. There is absolutely no correlation between the two. Every single child who developed MISC, when they did the RT-PCR, the child's levels of virus were basically zero. It means they did not have any viral present in the respiratory tract at all. But when a biopsy was done in the cells of the child, they found that this latent virus was present inside the child's cell, and the antibodies which were formed against COVID were now attacking those cells. So these children had very high titers of antibodies, very, very high titers of antibodies, no virus present in the system. They also had high levels of pro-inflammatory cytokines like TNF, IL-1, IL-6, and they also had very high levels of an anti-inflammatory cytokine called IL-10. IL-10 is like a brake. It puts a brake on inflammation, which is basically showing that the child's immune system has gone completely crazy. On one hand, it's increasing inflammation, and on the other hand, it's increasing the cytokine, which is trying to block inflammation out. Okay, so both things are happening at the same time. Usually, the treatment for MISC is very simple. The child is given some IVIG treatment, which is immunoglobulin treatment. What these immunoglobulins do when they are artificially given is they remove the body's immunoglobulins which have already formed. So they stop those immunoglobulins which have been made by the body from forming and binding to tissues. This is how actually IVIG would work. The second part of treatment, classical treatment, is you give the child some steroids. But in patients who have just gastroenteritis, who have gastric symptoms, the steroids don't work. The moment the steroid is stopped, again, the child starts to develop these symptoms. In some children, if the symptom persists and the child develops cardiac problems or they develop cardiac aneurysms, the treatment becomes even more complicated, where you have to start using biologics. So you can use TNF blockers, but again, they have so many side effects that happen with them. In total, around 1% of children who develop MISC ultimately end up dying, with the remaining 99% safe. So you can treat a child using classical allopathic treatment as well, IVIG and steroids, etc., etc. But the course of the recovery is slow and becomes complicated. If you simply are able to understand that this is happening in your child and just use these simple medications, you can immediately rescue your child. We've seen children having this gastritis after COVID recover within a few hours of giving the meds to them. They've stopped vomiting and they've been able to start eating within a few hours. If your child is continuously vomiting, within a few hours, he can develop ketosis. The ketone levels can increase very high. So you have to treat it on an emergency basis. And I hope that this webinar has been sufficient to explain what MISC is and that you can actually identify and treat it. Remember, the fever is the first sign that this is happening. Let me see the chats. Okay. So screenshot is not acceptable for your information. Very informative. Thank you. So a few questions. One is vaccine safe for epilepsy for a child below 8 years old? That's so difficult for me to answer, Doc, because we don't know what the safety levels of these vaccines are in children, although Pfizer says that they are safe and they have not found side effects. But as doctors in this group who are listening, we all know, we've seen severe side effects happening. So I really cannot tell you if it's safe, especially if your child is already having epilepsy. I really can't tell. I can give you one example of a child who was having mild epilepsy after taking the COVID vaccine. They were given the Indian vaccine. The child's seizures increased very, very badly. So this is one child that I have personally seen. Let me see if there are any other questions. Okay. I'm finding it difficult to scroll up. Okay, so let me see now the Q&A questions. Okay, so I think I've answered them. Mostly the high doses of vitamin C have also been. Okay. You guys can also ask me questions verbally. We can just unmute you if you want. No? Okay, so we are being told that don't let people unmute, otherwise it'll be chaos. If you have any questions now, please type them in the chat. I'm actually put the chat on so I can read. If there are any questions that you have about this, please type it in. Okay, one question, is it true after we get COVID, we will get natural immunity? So I've had COVID around at least 3 times, and I think it's been 4 times. So I've had COVID 4 times since COVID actually came out into the world. I was seeing patients right in the beginning when COVID first entered India, when even the tests for COVID were not available. So since then I've had it. So after 4 bouts of COVID, I've pretty much understood that you can never get the long-term immunity against COVID. While vaccinations are found to help, they've not found to be 100% effective. So, and again, with vaccinations, you see that the effect of the vaccine goes off within 3 to 6 months. So there is no long-term immunity possible against any influenza type virus. If long COVID by the vaccine, then how to detox? As I said, the simplest medication is my Imucil, which brings the inflammation down. It's also it's highly antiviral. So it helps to treat some of the side effects that the vaccine is creating on the liver. Yes, so as Dr. Lee is saying, there are many people who have taken the vaccines who develop the same GI upset that is being seen in patients. Well, I can talk about so many cases. I'll give you one example. This patient, after taking the vaccine, she developed severe dermatitis of the hands and the chest. It was all over her body. And she stopped having periods. So I said, oh, this is very strange. We got her estrogen levels checked, and it had increased dramatically. When estrogen increases, you get estrogen-mediated arthritis, which typically affects the finger joints. So patients get severe pain in the finger joints, and they have pain in their toes as well. So she had all these symptoms of high estrogen, and it happened only after the vaccine. So now you have vaccine creating high estrogen-mediated arthritis. So we gave her a few homeopathics like Ponium and Phytolacca, and after taking these, which are anti-estrogenic, the arthritic pains and the rash cleared off. So hers was not mediated by Epstein-Barr, hers was not IgA, it was simply caused by the high estrogen. So, I mean, there are such peculiar cases that we've done. It's really quite incredible. How long does a child need to wait after recovering from COVID before getting the vaccine? So ideally, usually they say around 2 weeks or so. But I mean, you can actually just check the antibodies of your child. If the antibodies are already high, it still doesn't mean that they are protected from COVID, because the antibodies may not be strong enough to actually bind and remove COVID. So again, while data shows that vaccines boost the ability of your body to fight against COVID, you ideally shouldn't give the vaccine until at least after 2 weeks to a month. So lots of phlegm and frequent coughing after COVID. Please contact Amanda for these specific questions. We can find a doctor near you who can help you solve your issue, because we actually need to know your lab parameters and what's going on in your body before we just give you a random way to treat it. When can I go for a booster? So again, these are all questions about the vaccine. Tiredness after vaccine, again, as I said, we just give Imucil and it heals off completely. So for fatigue after COVID or long COVID, please use Imucil. Our published paper is also just based on that we are able to treat fatigue in patients with long COVID by giving Imucil. There's not a single drug until now that treats the fatigue of long COVID. Imucil does. I've been invited to conferences now all over the world to talk about this, and my conference tour will start from next month. So please do read my published paper of Imucil to understand how it works. And for any medications, please contact Amanda, who can help you find a doctor near you and also help you get the medicines. So thank you all, for joining me and spending your Sunday evening with me. I hope that this information has helped you. If you have a child, I hope that this really helps you to understand the kind of issues that can happen after COVID. And again, as I can tell you, I've seen so many kids having this problem. They come to me with asthma after 2-3 weeks of recovering from COVID. I simply ask the mother, did your child have fever before you got the asthma? They say yes, that is MISC, and it's only happening because of acid reflux. So thanks a lot for attending this. Thank you again, everybody.
Okay, thank you, Dr. Tariq, for such a marvelous, refreshing, and informative webinar. And I know that the floor, they have more questions. If you have more questions or other queries, please contact me. My phone number is stated there. And everyone who have any further question, please welcome to WhatsApp me. Yeah, we will hook you up with the proper channels, doctors, or even Dr. Tariq himself. So thank you again. And thank you everyone for attending this webinar. And I wish everyone well and everyone healthy, and take care.
Thanks
Goodbye.
a lot, Yuval. Bye-bye. Bye, everybody.
Bye.
Amanda, can you hear me? I think some people are asking for your number. Just repost it.
Okay. Yeah, Dr. Tari, I'm busy answering the question they brought. Yeah. Yeah. You tell me.